Um, Good, I guess we are good afternoon now, everyone. Thanks for being here today as we shed some light on just how dangerous Glenn Youngkin's anti-science agenda would be for Virginians. I'm joined today by Dr. Lauren Moria, an Alexandria-based pediatric physician and a member of the American Academy of Pediatrics. Dr. Moria, thank you so much for being with us. As I said to you a minute ago, with everything that you've got on your plate, we appreciate you taking the time to be here with us today. Just last week, there were more than 250 children hospitalized for pediatric COVID-19 cases in Virginia. Now, that's the highest number since the pandemic began, almost a year and a half ago. From September the 10th to the 16th, there were nearly a 10% increase in confirmed COVID-19 cases for children under the age of 17 from the week prior. These numbers are really frightening, and they tell us just how dangerous the Delta variant has been for our children here in Virginia. Now, even with these numbers rising and hospitalizations also on the rise in children all across the Commonwealth, Glenn Youngkin continues to pander to his far-right base on vaccines and oppose common sense efforts to keep our children safe and Virginia healthy. Just last week at the debate, Glenn continued to spew his reckless talking points and reminding us of his opposition to vaccine requirements. On stage, Glenn revealed something unimaginable. He actually thinks a nurse who is taking care of an immunocompromised cancer patient shouldn't have to get vaccinated. His reckless anti-science agenda is dangerous, and his lack of leadership is disqualifying for someone who wants to be the governor of this great Commonwealth. In Texas and in Florida, where governors are prohibiting schools from following CDC guidelines to prevent the spread of COVID-19, schools have already been forced to close, and thousands of children are being quarantined following exposure. This is a model Glenn Youngkin wants to follow if given the chance. The consequences of this extreme agenda would be dire for Virginia and for our children. I simply don't know any other way to put it, folks. Glenn Youngkin and his far-right views will overwhelm our hospitals and threaten the health and safety of communities all across Virginia. Lives are at stake in this election. We need a governor who will follow the science and show leadership on this issue. It's the only way we're ever going to put this pandemic behind us and build Virginia back better. That's why we need Terry McAuliffe, who is showing real leadership and has a plan to keep Virginia safe, schools open, and Virginia open for businesses by embracing the science, trusting the science, and working tirelessly to get every eligible Virginian vaccinated. With that, I'll now turn it over to Dr. Moria.
Thank you, Chairwoman Swecker. It's great to be here today with all of you to talk about the importance of vaccines and safety measures to keep our children safe in Virginia. The number of children that we are seeing in the hospital with COVID-19 is surging. It's something we've not seen since the pandemic began. The 252 children that the chairwoman mentioned who were hospitalized in Virginia last week for COVID is the highest figure since the pandemic began, and it's 5 times higher than at the start of July. In the past 2 months, young children and teens have entered the hospitals with low oxygen levels, pneumonia, cough, and respiratory failure, the same symptoms adults have presented since March of 2020. A higher percentage of children who are COVID-19 positive are displaying symptoms, and those symptoms are more severe. Our healthcare workers have had to work through unimaginable trauma over the past year and a half, and it's even more devastating and traumatizing to see the rising number of kids who are testing positive and coming to the hospital suffering serious illness and complications from this horrible virus. And unfortunately, it could be so much worse in Virginia. We've seen the disastrous results in states where elected leaders aren't encouraging vaccines, masks, and other precautionary measures that keep the public safe. Prioritizing politics over science has resulted in hundreds of thousands of lives lost, including many children, and it could happen right here in the Commonwealth. It's sad and scary to say, but we've seen that same rhetoric here in Virginia from the Republican candidate for governor. The only way we will keep our children safe and each other safe and get through this pandemic is to get every eligible Virginian vaccinated. The vaccines are safe and effective. We need leaders who will support the measures that will save lives and keep folks out of hospitals and keep our children safe and in school. Unfortunately, Glenn Youngkin has made it devastatingly clear that he is not that leader. And I want to urge everyone to please get vaccinated and keep working together to keep each other safe. Thank you all for having me here today. And now I'll turn it back to Chairwoman Swecker.
Thank you, Dr. Maria. I think that concludes our